Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and it's October 21st. And we're joined today by Michael Lasher, who's the superintendent for the Douglas ESD, and Barb Hofford, who I know for many years, who's one of the district nurses at the ESD. So we're going to go through the review that we typically do, and then we'll talk with them about how things are going in the school. And I think the answer is really quite well. So overall in the world, COVID is kind of quiet. Most of the places in the world, there's less COVID than there was a week ago. Hospitalizations and deaths are starting to come down, except in Eastern Europe. So you remember Eastern Europe for the last 2 or 3 weeks has been busy, and now that's starting to spread to Russia. And in Russia now they're needing to do some fairly extreme lockdown measures because of the rising cases in Russia. So we need to watch out for that. Now, a lot of the people in Russia are vaccinated, but they're vaccinated with Sinovac, which has not been particularly effective against the Delta variant. So we might see that as another area in the world where we're starting to see an increase, and we'll keep watching. In the US, we're relatively quiet. The number of cases is down, the number of hospitalizations are down, and the number of deaths has now peaked and is now starting to come down. All really good news. In the United States, the only places now which are very active are in the Mountain West. So Montana and Upper Nevada, parts of California are having issues, but pretty much the rest of the country is pretty quiet at this time, and that's good. Alaska is still struggling, though. Alaska still has a lot of cases, and we worry especially about Alaska because it's so spread out, and their hospital system is so dispersed. So there are some worries there. In Oregon, a number of cases is flat. It's much worse in Eastern Oregon than it is in Western Oregon. Eastern Oregon is seeing a lot of cases still, but remember, they have a relatively low population, so the total number of cases is not that high. In Douglas, we had our big peak in August and September, and we came down, but we're up again a little bit this week, and that is a little bit worrisome that we're up again. When we're seeing outbreaks, we're seeing them mostly in areas where people gather together. So we're seeing these in workplaces, we're seeing these in families, we're seeing this in some of our long-term care facilities, and we're seeing this also among other times people gather, and sometimes that's people at school. I will point out that except for one outbreak at a boarding school in Douglas County, our public schools have done remarkably well in not spreading this disease. And we'll get to Michael and Barb in just a bit about that. The big news this week has been about the booster shots, and the FDA has now approved booster shots for Pfizer and Moderna. And just today, as we're speaking, the CDC advisory panel is looking to see about how we should give those and who we should give those to. So I would expect by next week, we should have some very good information about booster shots. The other thing that's happening, and this is really important for school, is that shots for kids ages 5 through 11 are going to go through the FDA panel within the next few weeks. And we would think that by November, shots for kids 5 to 11 are going to be approved. Now, they're going to be slightly different because they're going to be a lower dose, but otherwise very similar to the vaccines that we've given for adults. Other things that are moving along, molnupiravir, which is this antiviral drug made by Merck. It looks like it's moving its way through. So an antiviral drug is a drug that you would take after you were infected to help keep the virus from spreading. That's not surprising and certainly nothing new. For other viral diseases like herpes, we have acyclovir. For flu, we have Tamiflu. For hepatitis C, we've got antiviral drugs. For HIV, we have antiviral drugs. So this would be similar to the way we've treated other viruses, and many of those can be really quite effective. This molnupiravir is probably not 100% effective, but maybe 50% effective in preventing hospitalizations. And the other thing that happens when we come to October is we know that influenza is going to be around. So influenza goes around pretty much every year. Now, last year, it did not spread very much. And the reason it did not spread very much is because people were wearing masks and distancing, staying home when they were sick. And in comparison, flu is a wimp in comparison to COVID. Much less contagious, much more obvious when you have it. So it just does not spread as much as COVID, which spreads a lot before you know you're sick, and spreads to far more people. So last year, we had very few flu cases in Oregon, less than 100. And so we don't know what the flu season is going to show this year. There are predictions anywhere from it's going to be just as quiet as last year to it's going to be a really bad season because we didn't have one last year. So the range of what it could be in flu is wide. So we are recommending that people get flu shots. We still have open our FEMA trailer. They're open through Friday, and they are providing COVID shots, flu shots, and COVID testing. So if you want any of those services, it's free, drive-through, really easy to get. So get a flu shot if you need one, get a COVID shot if you need one, and then you can get tested if you want it. So one of the things we talked about with schools, and schools have really done a remarkable job. Well, there have been a lot of cases at school, usually brought in from parents to the kids, and then the kids have it, or teachers get it, bring it in. We have seen very, very little spread in schools, and I think that's thanks to lots of work, but certainly Michael and Barb have been leading that work. So thank you for joining us today.
Well, it's our pleasure. Thank you.
So, Michael, you and I talk pretty much every Wednesday for the last year and a half now. So tell us how the superintendents and you have been involved in this COVID process.
So thank you, Bob. Yes, we've been talking with Dr. Bob every Wednesday at our Wednesday superintendents meeting, where he gives us a briefing about where COVID stands in the world and in Douglas County and in the schools. And then answers are usually a laundry list of questions from superintendents that either they've been asked or they've come up with to know how to address that with their students and with their staff and then with the community at large. So we've been very grateful for Dr. Bob and all that he's done in keeping us informed of the pandemic.
And it's certainly been my pleasure to do that. You guys ask some very difficult questions sometimes. So one of the things that comes this week is the vaccine mandate. And we know the vaccine mandate is that people in education are vaccinated or have an exception. Tell me how that's gone for both the ESD and for the districts that you work with.
For the ESD, I think it went really well. We had about 80% of our staff is vaccinated now. So we were very happy about that. Some of our back office employees who do not deal with students ever were permitted to continue to work without having to have a vaccination or an exemption. We did grant a number of religious and medical exemptions based on the guidance that we got from the Oregon Department of Ed. And so I think that went very well. You also, I'm sure, saw the headline in the paper about Roseburg meeting a very high standard for the vaccination requirement. And from everything I've heard, other districts have, it's gone smoothly elsewhere as well.
And kudos to them. I think we have seen, that's one of the reasons we don't see a lot of spread at school. Well, when there is a case at school, where we try and track down the people that those students have had contacts with, and that hard work is mostly done by Barb and her staff. So Barb, tell us how that's going.
It keeps us busy. We have been able to add a number of nurses because of the COVID load that we have been carrying, but it's nice when it kind of lets down and we can actually do the other nursing stuff that we'd like to be doing. But if there's a case that's reported in a school or a child has been in contact with someone, then we do contact the families or contact DPHN. We work a lot with the Public Health Network, as you know, Dr. Bob. We're calling them every day about something, and it's been delightful to work together on this. We lean on each other a lot for gathering information and getting accurate dates, so kids don't have to be out of school any more than is necessary, but we make sure that they stay out the time that they need to be out in order to keep everyone safe. And
that's our goal.
That's our goal, right?
Our goal is to have kids in school as many days as they can, but when they need to be out, they should, because if they go to school when they're infectious and they infect other kids, and then they're out. So we've been very, very effective. I think, Barb, your nurses are incredible. We, in fact, when we look over this school year, we're not sure we have any in-school transmission in classrooms. Now, we think we've had some transmission among sports teams, and we think we've had some transmission with extracurricular activities. You know, you stay over at my house and play video games for 4 hours. I'm going to infect you. Those kind of things happen. But in school, we've not seen very much transmission, and kudos to you. So what are they doing in the classrooms to prevent transmission?
we're making sure that it's let up a little bit from last year because we just know more about the infection now and how it works. But kids are 3 feet distanced, wearing their masks all the time, unless they're outdoors, and then they can have their masks off if they're able to, stay far apart. And they do pretty well with that. I'm amazed at how well kids keep masks on. It's really not a problem. And I know even at the high school, they just have to go like this if the kid has his mask down here, and the kids put it up and they walk on. But it's really not been a struggle, except for with our special needs kids who just have sensory issues, and that's a problem anyway. But as much as possible, we try to help them to conform to that rule. But it's really not been an issue for most kids. It's just what they do, and when they don't have one, they come in and get a new one or whatever. So the distancing and masks, it works, and we're just glad that that's working.
And kudos to you. Yeah, one of the parts of being a pediatrician is you recognize the kids really don't usually complain. They break their arm, they put a cast on it, and they basically don't even recognize the cast. Whereas we as adults, get a little boo-boo and we're complaining to everybody about it. But that's one of the great joys of taking care of kids. So, Michael, what do you see for other activities? So we're seeing sports, I guess, and I see Roseburg is doing great in football this year. And so what kind of feedback are you getting about extracurricular and other activities?
I'm hearing from the superintendents largely at our weekly meetings that many of those are going on as normal, particularly if they can be done outside. And then if it's an after school activity that happens in the gymnasium or club or something like that, they're of course wearing masks and trying to stay socially distanced to prevent any kind of spread or infection. So I think that's, as you've said, the spread in schools is relatively minimal. We do see it, of course, when, after the football game, the team hangs out, or goes, as you said, goes to each other's house. So there are some kids that are getting COVID and maybe even spreading COVID, but we're not seeing it happen in the school because, as Barb pointed out, they're largely following the rules, and it's really not been the issue that it's been made out to be in some parts of the media.
Yeah, I think mostly adults are the ones who are complaining. I usually don't see kids complaining. This last school year was a hard year. Now, Douglas County had more kids in school than most counties in the state, but still a lot of kids did a lot of distance learning. And I know from talking to kids that for some kids, distance learning was hard. So what have we seen in terms of achievement this year, or what have we seen this year in terms of stuff kids missed last year?
We're seeing, I think we're seeing some, I guess, lack of growth that you'd normally see if kids were in school for the entire year. And I think that's why there's such an emphasis this year in having kids in school for as long as possible, because we did see achievements slip throughout the state. I think it is important to note, and this is, I don't specifically have any sort of data on this, but certainly the anecdotal data from the superintendents and from the schools is there was about 10 to 15% of the kids that really excelled at distance learning. They really, they weren't in an environment where they were anxious. I mean, if a child is anxious or, heaven forbid, they're getting bullied, that's a real impediment to their learning. And there were many cases that people reported that, a Sally or a Susie were doing much better in school and actually doing quite well. So I think we may see in some of the districts, at least, that distance learning will stick around for a while, or I think more districts are open to continuing that beyond the pandemic for those kids that really do better in that kind of site. I mean, I never would have thought that video conferencing like we're doing today would become such a norm and so commonplace. It was something that we did occasionally, but I used to travel 2 hours to a meeting in Salem, once every couple of weeks. And No, I won't, and none of my peers are going to ever do that again because it's just so easy. We don't have travel time. And so I think there's been, I don't want to say that's the benefit of the pandemic, but I think that's the benefit of learning from the pandemic, that the workplace is going to change, and I think school is going to change too.
I think they will too. I did a little talk about the silver linings of the COVID pandemic, and this was one of them, is that we've normalized things that we otherwise wouldn't do. And so I similarly would go to Salem for a meeting and would be hours of travel and wasted gas and whatever. Now the meetings do very well, and they allow me to do other kinds of things rather than drive my car. All right. Well, thank you guys so much. This was great. Keep up the good work in schools, and I'll talk to you next Wednesday. Again, this is Dr. Bob Dannenhoffer.
Thank you.
Take care.
This is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County, with another of our COVID conversations. Thank you.